the most scary aspect really this morning came when Gangaram Hospital, one of the main hospitals of Delhi, released a statement saying that 25 sick patients, their sickest patients, had died. They also said they were running out of oxygen in 2 hours. And of course, we're getting frantic SOSs from various hospitals every 1 hour saying they're running out of oxygen in 2 hours. Imagine what it's like for the patients, for their families. We have this special report.
Outside the emergency ward of Delhi's GTB hospital, these two brothers in tears. Sujay and Vijay Ghosh desperately tried to treat their brother Sukhant, seriously ill with COVID. But after a 4-hour wait for a bed, Sukhant died at the entrance to emergency. Outside Delhi's Pentamed hospital, Pradeep Mishra breaks down. Pentamed Hospital ran out of oxygen this afternoon, asking patients to arrange oxygen cylinders or shift them elsewhere. Mishra's mother, seriously ill with COVID, is inside.
मैं एक नॉर्मल आदमी हूँ, मैं कहाँ अप्रोच करूँ और किसके पास जाऊँ कि मुझे सिलेंडर ऑक्सीजन मिल जाए, क्योंकि हॉस्पिटल में इतने पेशेंट हैं, वो पार्शलिटी तो कर नहीं सकता कि नहीं मेरे को अलग से दे दे। तो मैं अब अपने लेवल पे कहाँ चला जाऊँ कि मेरे को एक सिलेंडर मिल जाए, ऑक्सीजन मिल जाए जो मैं कर लूँ, और फिर मेरी कैपेसिटी से बाहर वो चीज़ें मार्केट में मिल रही हैं।
In one of Delhi's biggest private hospitals, confusion deepened over whether a lack of oxygen turned deadly.
Sir, Gangaram Hospital put out a message at 8 a.m. claiming 25 of their sickest COVID patients had lost their lives in the last 24 hours. Their ventilators and BiPAP machines had stopped working effectively, and the lives of another 60 of their most sickest patients were in peril. Something their medical director, Dr. Katoch, also confirmed to me on the phone.
But the hospital's chairman had a different version of events.
Is this due to lack of oxygen supply?
That is not true. They have not died because of we were not having oxygen. We are maintaining oxygen supply at lower level, and there have been no deaths because there is no oxygen at all. And that point has not yet come because state government and central government, they are ensuring a constant supply, though at a low level now.
For the third straight day in a row, Delhi hospitals sent out SOS messages to the government urgently requesting medical oxygen. From Max Saket to Batra Hospital to Holy Family Hospital.
We have about 500 liters of liquid medical oxygen left with us. Now this is enough for half an hour. Now think of a patient's life after half an hour. We have declared emergency. We are running from pillar to post for the liquid oxygen.
Oxygen does arrive at the last minute, like at Delhi's Holy Family Hospital, but there is no guarantee when the next batch will come.
It was a very critical situation. We had almost last 30 minutes of oxygen left in the tank, the liquid medical oxygen. So we had made a backup of multiple cylinders that we had lined up to have some more backup, but we didn't know if it would work because the load is so high. We were not sure that it would collapse or it would work.
Just in the last half an hour, we have seen 3 crises here at the GTB emergency ward. There are no beds here, but an overwhelming wave of patients who need help, beds and oxygen. There is oxygen here at GTB, but no beds. Other hospitals are left gasping for air with an unreliable oxygen supply. With Akshay Dongre, Sushil Rathi, AJ Joseph and Saurabh Shukla, Meher Pandey for NDTV.